Okay, Iryna, please. Dear colleagues, good afternoon. Thanks for everyone who is present here in Ukrainian Crisis Media Center right now. That's not our first meeting in this room when we discuss the medical reform and also the new implementations that we face. My name is Roman Popinovsky. I work as a communication manager in the Ukrainian Crisis Media Center, and we are going to talk about the medical reform, what kind of changes it brings. We talk here today. So today we have a really narrow team. We are talking about the reimbursement of insulins, about the scheme of reimbursations that has been working for some period of time. In 2017, in case I'm not wrong, there was the pilot project started. In case of the hospitals do not buy the insulin, we have the reimbursement program. It means that patient receives the possibility to get to the pharmacy and to receive their medication or to receive money for those medications. It would be not possible in case we do not have e-register. The e-register of patient, that's the availability of e-register. That's one of those things that in the reform give us a lot in different kind of other spheres. And what now we are going to clarify what kind of e-register availability and successes it has brought us, and what kind of costs and pros did patients and physicians receive. What else do we need to do before the elections, before what we are going to have, the new government, the new authorities, the new ministry. We are going to fix what was mentioned, what was done, in order for us to be easier to clarify and to move forward. So today's speakers, we are waiting for Olexander Linchevsky, who is the Vice Minister of the Healthcare of Ukraine. He's a little bit late. Iryna Kondratska, so the PhD in the Department of Diabetology of National Academy of Shupik. She's an expert of Ministry of Healthcare regarding the endocrinology. Tetyana Dumenko, the Director of the State Expert Center of Ministry of Healthcare of Ukraine. Stakhovska, endocrinologist out of Zhytomyr city. We really want to hear from you how it looks like in region, because in Kyiv we might talk a lot about the reform, and then to clarify how does it look like in fact. Lyudmyla Petrenko, who is the president of the UDF, who is the member of the International Diabetes Federation, and also Shehnaz Karadeniz, the president of International Diabetes Federation in Europe. We're really thankful that you found time and visited us today. We would really to hear your opinion regarding what is going on right now in the Ukraine. We are going to start with Iryna, because Alexander is a little bit getting late. So Iryna, you developed this system, you participated in it, you had some assumptions what may happen, what kind of results and advantages we may receive. Starting from the 2017 up to this moment, what did we receive from your point of view, what worked out and what didn't? Please take your mic. Okay, the mic is working. Just one thing I would like to ask all of the speakers. In order for us all to have the possibility to give their speech, approximately 7 minutes. I'm going to stop you. Every one of us may talk about this for hours, but in order for us to hear the main things and the main opinions, and for us to have the possibility to discuss, because we also have the representatives of other patient organizations in here, let's follow the agenda up to 7 minutes of the speech, and I'm going to stop you. Then we're going to have time for discussion going on. So thank you. I would like to greet everyone. I'm really thankful for all the journalists that are present in here today, because the ensuring and the provision of patients with insulin, that's extremely important thing, because in Ukraine we have a unique system. First of all, we have the e-register of insulin-dependent patients. That was the first register, and that's the only e-register that was officially registered. The second was the e-health system. I'm going even to say that we received really data that we didn't expect, because register gave us the possibility to control the fact amount of patients, and we have the difference of the 40,000 difference before the register was implemented, and that's huge costs that we saved when we implemented, and we saved approximately 1/4 of billion of hryvnias thanks to register of those real patients. Besides that, we have the possibility to control how the patients are getting compensated, are getting controlled. We didn't have this possibility before. The patients, the physicians to insert the glycerized hemoglobin level, which actually resolves and shows the compensation level of patients. We also had the possibility to control not only the level of compensation, but also the amount of patients that were observed. Besides that, we insert online the data of complications in case of unsuccessful treatment, and this gives us the possibility. The statistic data didn't give us this possibility to do it before, but e-register gives us this kind of possibility right now to control the complications among the patients with diabetes. It was really well controlled how many of the recipes were prescribed, how many prescriptions were done, and how many of patients received in the pharmacy the insulin in the pharmacy. So the funding control, which is also really important, not only for physicians, but also for those who control the system. And physicians, of course, receive the possibility to control how do they compensate and treat their patients and what kind of complications we may face. We faced unexpected data because we always thought that we have myocardial infarctions, but we received another kind of information, the amputations. It means that patients are really decompensated, that patients with the glyceride hemoglobin for a long period of time was higher than 10.5 units. That's why we have a lot of amount of amputations going on. It was really unsatisfactory information that we faced. We work with it right now, and we discuss how to solve these issues. And I would like to thank the programmers and also the State Experts Center who developed this e-register. It is really perfect. I think that's a huge breakthrough. And Victoria out of Zhytomyr is going to tell us in details how exactly the endocrinologists changed the character of working thanks to the implementation of e-register. Also, I would like to say that we received the information how exactly physician works, because we have nice tools, the e-register. It gave us the possibility to insert the indication of the quality control of the medical care for patients with diabetes. All of that might be controlled thanks to the e-register. So in fact, thanks to this e-register, we saw that the situation with this disease is a little bit different than we expected it to be, as it was according to the statistic agency, according to official statistics. Yes, we faced another statistics. Maybe the government may change its own policies for the patients to receive better treatment right now. The state has to change its policies in order for patients to receive better treatment. We are going to ask Olexander Linchevsky when he is going to be present. Right now, I'd like to give the floor to the Tetyana Dumenko, who is the director of the State Expert Center of Ministry of Healthcare. What information did you receive, and what was the information you were the most amazed about, and how patients are going to receive advantages? Good afternoon. Thanks for invitation to share those experiences that we really received participating in this project. The State Expert Center and its experts participated by different directions that were working. We were the members of the expert working groups when we discovered the reference prices to find out the methodic. There was a huge group working for more than a year, and we actually administered the register. But answering your question, I would like to say that we received really unexpected experience regarding the communication with a lot of regulatory structures, because register itself is a really complicated system. In order to receive and successfully use and to be sure about the data that Iryna mentioned, for example, we need not only to have the general understanding of all the stakeholders of this process, but also the responsibility of each of these members and stakeholders. Our responsibilities are actually mentioned in the legislative base. I'm not going to cover that we have what we need to do, what administrators need to do, but when we developed the register and we used the services of developers who had their own developments that were evaluated as their personal development, and that was non-competitive alternative to start it really quickly, we found out this system, how it works in order to work with the developers. The system had evaluation from the pricing point of view and also from the intellectual point of view. Besides that, we fully understood that in the system we have a huge information of personal data of patients. Some markers that might talk about the professionals of all the endocrinologists. And to be responsible for protection of this data was the complex system of information protection that was built up. This system is already built up. We validated and certified it in our state connection center, and we received appropriate certificates. I think that my colleague is going to continue to talk about it, how to receive the keys, how she uses. We are talking about the endocrinologist out of Zhytomyr. This is a really complex system of protection of personal data, and even the movement of center from one place to another needed an update of this system, and right now we have gone just half of the way regarding the updating. We have the new update going on for the new address, we received the new challenges, and I think that we are not going to receive anything to continue working with it. I would like to cover one more issue that we always face to our expert center. That's not our direct responsibilities, but there is a question: what happened with the amount of the insulin that was consumed, and what happened with the price for the insulin? I'm going to address an open source of one of the marketing organization. You may see over there the resource, the source, that at the start of this project we found out the reduce not only in amount of insulin that was consumed comparing with the previous years, but also the mean amount of consumed insulin for the whole year, and it is in amount of the budget costs that was used. Traditionally, insulins were procured in the first half of the year in the needed amount because this is the critical life-saving medications that was needed. The next slide, please. The next slide, please, in case it's possible. And over there you may see the red line. The red line tells us how the mean price of the insulin was changing. The vertical line shows the start of this project in general. All of the regions actually participated from the start. There was Dnipropetrovsk and Ivano-Frankivsk regions that were a little bit late, but you may see that even at the start of this project the price decreased up to 15%, and it means that the amount that was already mentioned that was saved, 250 millions of hryvnias that was preserved because of the patients that were absent, and the consolidation of data on the national level. We add also the savings thanks to the positive influence on the pricing. Today, once per half a year, we reprice the medications. It is done by the State Expert Center of Ministry of Healthcare, but also there is an expertise in the Ministry of Finance and is approved in the Ministry of Healthcare. We may say that there are some changes in pricing, but it's much less than we compare the mean price and the market. The medication, as usual, increases their price, but with insulin it doesn't happen, and that's the first thing. But what else did we see, and what kind of information we received? That patients that received medication for free before, that they had the possibility to be procured during the budget costs via the system, right now might be just co-payers, and the amount beneficiaries of those patients are present. And the experience is really unexpected. For 2018, we were really fighting the State Expert Center of Ministry of Healthcare, the functioning of the e-register itself. Despite all needed procedures, we had procedures that were going on. We also had the 2-day investigations from the court. We tried to get the servers out of our offices. It was done by a lot of amount of powerful sources. We thought about that. We addressed the Ministry of Healthcare, but this issue is not closed right now. Despite that we actually returned the original of the documents, we have an information right now that there is an expertise of the register going on, and also I would like to say that there is a risk of suspicion regarding different kind of crimes of specialists that were involved in this e-register development process. I would like to address to all the patients who receive insulin. It is really hard not to get the possibility to access to the personal data. Right now we are responsible for your security, and none information was received to none of the hands. It was completely protected and secured. I think that we have the possibility to protect this e-register database because that's the huge experience. We are the pioneers in the e-health system in general. In this register we have all the main chain, the stakeholders in the procurement system. In the pharmacies there is the decreased of amount of medication. In the pharmacy you don't need to have the whole resource of medication. The pharmacy knows that there is the patient that is going to visit this pharmacy, and then he might not need the insulin he received for the nearest months, for example. Also, we had the questions that were traditionally asked regarding the inpatient treatment. There are the possibilities of tenders for the insulin procurement in vials in case the patient really needs it at the moment, and that's the primary patient, the newly established patient, or maybe the patient who receives the insulin for the short period of time. For the patients who receive insulin, who knows how to administer the insulin, they get to the endocrinologist regarding their place of living, and during inpatient treatment use the insulin that was reimbursed thanks to this system. That's everything I wanted to say. Thanks for your attention. In case you have any kind of questions, feel free to ask. We are going to hear all of our speakers, and then we'll have the possibility to receive the questions and to discuss a bit. In case this e-register is not going to work, or whether it is going to be stopped the reimbursement period when the person is going to receive whatever they want, is going to be impossible to reimburse it, is it? Yes. When we had these procedures going on, I disagreed, and my co-workers too, to involve into this system, because we understood that the life of one person does not need to be included into these procedures. We cannot interrupt the procedure, the register itself, because it is going to lead to the risk of non-receiving the life-threatening medication up to 185,000 of patients. I'm going to address Victoria Stakhovska. You worked in Zhytomyr city, in Zhytomyr Oblast region. So how did it change for the physician that prescribed the insulin before? How it was changed for the patient? Because the register is also a success for the government. But what actually changed on the level of patient-physician communication? Okay, thanks for this question. Dear guests, I have a huge experience as endocrinologist, but also I'm an expert regarding the endocrinology in Zhytomyr, regarding the Department of Healthcare in Zhytomyr. That's why I may talk not only as a practical endocrinologist, but also on the second line, which was delegated the access to this register thanks to the Ministry of Healthcare on the local level. A really small excursion in our history. What did we have? We have the tender procedure going on. How it looked from the endocrinologist. Endocrinologist, despite its function, should create the report to receive the insulin medication and to send it to the higher securities and authorities that were participating in tenders. The procurement system itself, that's the situations that might have been going on for a long period of time, and patients received this procured insulin in the second half of this year. During the first half of the year, before the previous system, in the first half of the year, insulin was absent. How people received the insulin? They ensured because of the reserved amount of insulin that was bought during the previous years. That's how this situation was going on, and this state was supported. Of course, the endocrinologist with the patient were on the first line and faced all the challenges that existed with this system. In 2016, when we first met the information that we have the pilot project that is going to be implemented, our oblast was one of the first one to propose to try to train into this register usage, to try out what kind of pros and cons exist. And this was our common decision of endocrinologists in our region that work in cities, that work in the regions. And we actually received this proposal. We proposed it, and we were one of the first ones who participated in this e-register to train, to do their proposals. And we did it using the emails, using the direct meetings, were participating in the improvement of this system. And our patients helped us, of course. Without patients, the endocrinologist, that's just one man in a field, and he is not a warrior. That's why we work with our patients, and we work on our rules, because our main aim is to ensure the patient with the medication from one side and from another side the great treatment and medical care. And we understand that we just made the first step further. This is a really powerful step. We cannot make any kind of steps back. But how it looks like now? Previously, there were the medications in the office of endocrinologist. He had him in the refrigerator. He was doing the report system, and besides his professional activity, he did a lot of things that he didn't needed to do. Each endocrinologist right now has the possibility to access to the e-register right now. This e-register was received officially by separate procedure, by emailing with the Ministry of Healthcare and the Department of Healthcare, and this access was received confidentially. And each physician who received this access cannot administer this access to another person. Each physician has a second person who duplicate its things. That's why in case physician goes into vacation or receives the qualification courses, there is always another man who is also trained and who has skills and who has its completely different access to the same register. What did we receive? Each patient is administered to one and another endocrinologist regarding the place of living. The patient administers the physician. He gives the personal data to the physician. That's all the PES data, the number of identification code, and the whole medication information that is in regarding his disease. That's why each visit of medication, there's an opening of the personal page of the patient in the register. He examines the patient and forms the e-recipe, e-prescription to one or another medication of insulin, whether it is needed. That's why the physician does what he is needed to do, to examine the patients and to give the recommendations. He forms the e-prescription, he prints it, and then what is needed for the patient to do? We need just to receive different kind of approval by this institution. This is not really done because he really needs to take this prescription and go and to receive approval in the hospital. But this is obligation right now because these are the procedures that have the reimbursement behind it, and because we do not have the e-signature, digital signature, we don't have a protected system. When we can do it without signature, we still do it. Maybe you've heard it, we name it as the red stamp. That's a separate stamp for the reimbursations, which is a VAT stamp, which gives us the possibility to reimburse the costs. That's why from the endocrinologist point of view, he just has only his professional activity, and patient has the possibility to receive not the medication out of the refrigerator in the office, but to receive the prescription for those medications that he needs. What's the next? Then patient goes with this prescription into the pharmacy. We understand that this is a printed one, and the original e-prescription is left in the data, in the register, and the pharmacy who has the contract with that institution of the second line, for example, that's a city hospital or district hospital, or that's the amalgamated community hospital. In the legislative community, the pharmacy that was working in this pilot project has the possibility to use this prescription and to receive reimbursement from the government. And then the patient goes to any pharmacy who has the contract in this local area and receives the medication using this prescription. Where do we see any kind of risks or disadvantages? First of all, advantages. The register gave us the possibility to have the strict information regarding the amount of patients. Patients are not duplicated. The prescriptions are not duplicated because each prescription has its own identified number. And whenever the patient would leave, just 1 minute left, it gives you the possibility to be in any specialist, to visit any specialist. The specialist that was approved by this procedure of e-register may find out the data of this patient, but the data is individual and protected and secured. What do we have right now? We have approximately 50% of the funding for the insulin medication. That's the biggest issue that endocrinologists face and our patients face. The register exists, there is the medical services, we have the medication in the pharmacies, but 100% need cannot be procured and provisioned because we do not have 100% of the funding. The online register gives us all amount of information needed. We're talking about the local budget or the government budget. The main amount, that's the government and partially the local budgets. When we receive this funding, this is called as the funding of the oblast state administration, area state administration. That's how they divide those funding according to the amalgamated communities or the districts, and that's how the reimbursement performs in the pharmacies. So right now, the physician, the endocrinologist, just does their physician activity. He examines it, he leads to the reimbursement, he defines the glyced hemoglobin level, and I would like to say that 3 years ago, the patients who received the high expensive insulin should visit the expert commissions. So each 3 months they needed to visit the commission in order to receive this high expensive insulins. Now we do not need to have it. The procedure is getting much more simple. Please, Lyudmyla, Petrenko, giving you a word, your personal idea about this pilot system. The presentation is not going to change that I'm going to stop you in 6 minutes. So what's your opinion regarding everything that is going on, and how did it change during the long period of time? Because I know that you've been protecting the patients for quite a long time. Sorry, the mic is not working. To secure the patient's interest and also to influence the healthcare and its structure to solve the issues of the diabetes. The reimbursement procedure that we've passed after the centralized procurement system, then decentralized procurement. Right now we had the reimbursement going on. The reimbursement that we were achieving, we were trying to do it for 13 years. The first time in 2005 with Yulia Vladimirovna, who was the Tymoshenko, who was the prime minister at that moment. We were working with her, but despite Yulia was working just for 1 year, she didn't have enough time to sign up the reimbursement program to be implemented. And then when she returned in 2009, we always raised this question, but still for 1 year she didn't have enough time. And in 2015, with Arseniy Yatsenyuk, we raised this issue. So what Prime Minister wanted us to do, we were really happy that when we met with him, he told us that I think that this should be this way, but I'm going to listen to you. Okay, let's just do it without surnames because we're going to have elections in a few days. They wanted to have a card, the credit card for each patient for 250 hryvnias for each month. What can patient actually procure for 250 hryvnias? The patient should buy it themselves, and that's why he took the decision and to approve the order of the reimbursement system. What do patients have? We've already heard about that. On the Telegram program, in the internet, we may see what kind of subvention was getting into the region, how many patients we have in each of the regions, what's the sum of the payment, additional payment they invest. So we have the amount of patients, and that's how we may calculate our need. I would like to say that the Prime Minister right now, the Minister of Healthcare, do not calculate it correctly right now. We need 1,300,000,000 thousand. Right now we have a much smaller amount of funding. So 2 years ago, they thought that 50% of the funding is going to be out of the budget subvention, 50% is going to be out of the local budgets, without analyzing that local budgets cannot procure it by using this 50% of the budget. They do not have enough financing, and the government does not give 100% subvention. We had the letters from the local governments, local authorities, and for this year the Ministry of Healthcare promised us, it was mentioned on their website, that the government budget is going to provision the 100% subvention of the insulin, but the newly established patients are going to be insured by the local budgets. We may see the 20% out of those subventions that we're getting into the regions. That's not enough. Right now we are really interested. For example, we have Dnipropetrovsk, Lyudmyla. What's the percentage of the provision you have right now in Dnipro city? We are going to have those scenes after the discussion, after your speech. You are going to listen to her from the first person. So we have the 70% of the money that was already paid, and that's just the middle of the summer. So the money is going to be ended by the autumn. So the local budgets has to ensure the money that is needed for the patient to be insured with the insulin, or the government should give dotation in order to cover the 100% need. That's what we are highly interested in. We are really happy that this system works right now. We've heard that there is some wish of those who didn't have money anymore. I mean those who were participating in tender procedures, because for the last years there was always the blockage. We had the blockage in 2013, 5 tenders. So people for 3-6 months didn't have any kind of insulin before the tenders are going to be unblocked, the new procedure is going to be done. The people are without insulin, they decrease the dosage. That's why we were not for the tender procedure. But right now, the departments of healthcare in oblast and areas, that's their interest in tender procedures, and they do not control it right now. Some of the oblast state administrations have question raised right now on the self-authorities in order to return to tender procedures. We are against it, of course, because that's the corruption risk. We get away from them thanks to this system. That's why with all our efforts we are going to fight to avoid the return to the tender procedures. There are some cons, as in any system, but the main con is that for the all years that we've been working, we always fight to receive the funding for the insulin procurement. We are not even talking about that our adult population is not insured with stripes. It is really hard to control without the enforcement of stripes. We just received that our children have the glucometers right now, that have the stripes. Of course, not enough of them, but somehow still. Right now we need to think how to provision the patients with the stripes of the adult population. 1 minute left. Okay, thank you. I understood that. That's why I'm going to address the Linchevsky Olexander. Before the previous scene, we had 3 main questions to the Ministry of Healthcare. The first is what we heard from the experts. The system of e-register gave us the possibility to have the results of the treatment, and we found out that there is an issue, huge issue, that patients that receive insulin do not receive adequate treatment. Maybe we need, in case I understood Iryna correctly, to change the treatment and change the approach to the treatment, because in case we found out that there are a huge amount of patients with amputation, maybe we do not know what exactly is going on. That's the e-register data that was revealed. Though we are going to start with these questions, this is the first one. Second is regarding the pilot project of reimbursement of insulin and e-register in general. We heard more positive things regarding the work. So what does Ministry of Healthcare think? And Uliana Suprun mentioned that there should be some kind of transition book, whether this team is going to be left, or whether it is not going to do, or what kind of transition book we are talking about. And the third thing, that's regarding the patients, their funding. The Ministry of Healthcare position regarding the issues that was mentioned, that we have system, but we do not have adequate funding. We are going to start with the first question. The first question was regarding the data that from the physician point of view were revealed, and we faced another data, according to the register, another different amount of patients and more negative complications regarding the inadequate treatment. What can we do with it? First of all, the final aim of Ministry of Healthcare or cooperation with the Ministry of Healthcare, that's the provision of the high-quality insulin to the patients. That's the final aim. The health of the patient with diabetes, that's what we work for. The implementation of the register, that's one of the tools that we are going to talk. We are going to mention it, but that's just one of the tools that didn't exist before, or it was just started to be piloted, but it didn't work as it is right now, and gave us new understanding of this issue. I would like first of all to underline and first of all to focus that we need to thank and to understand a huge role of developers of this register. To thank those of our colleagues, friends, partners who were participating in development. We need to thank the State Expert Center. Right now, when we are talking about analysis of analytical data, when we moved and when we talk about the new data, about new issues, new challenges, we forget about that huge work that was conducted by developers and the State Expert Center. We, in fact, do not talk at all about those huge attacks and pressure on the developers and on the State Expert Center. We have already forgotten. And thanks for you for reminding the tender procedures regarding the possibilities of corruption interests. They do not get anywhere. They are just changed because of the register. That's how they secure us, physicians and patients, from those corruption scenes that was going on previously. And we need to remind that up to this point, the developers are still under the huge pressure. The servers are taken away. There are a lot of different kind of courts and attacks, issues that are more or less powerful are going on in the State Expert Center in order to continue the work of the e-register. And developers and distributors, producers, maybe the local governments, local authorities, I'm not going to say what kind of them, but those corruption people that were not interested in the register, they're still there. They continue to work. And thanks to the State Expert Center and their cooperation with the developers, this register still works. I ask you to remember about it, and I always underline it. And now getting to the question itself. In case we are talking about the things that were on the surface, first of all, those saved costs. We are not talking about costs, but these are the costs that are all left in the system in order to procure the insulin. Then, the register right now gave us... Sorry, I'm just going to clarify. We had the saved money, the numbers that were mentioned. These are the monies that was saved are also going to be used for the insulin procurement. Am I correct? In case we're talking about the saved funding, it increased the amount of monies that might be used. Yes, the state subvention for insulin procurement has never decreased. Right now we receive the analytical data. Finally, we know what is going on. Finally, we know how many patients really we do have. we really know what kind of insulin is prescribed. We understand and start to understand what kind of complications exist. We may use this data finally. This data give us, of course, the field to do something, but someone would like to hide this information. But this data is available and we may discuss it. What's the role of the Ministry of Healthcare, of the department? So what's the further funding of the central budget, and what's the role of the local departments of healthcare? We might talk about it right now. The register gave us this possibility. In case we're talking about the medical point of view, we're not talking about it today, but what kind of protocols do we have? What kind of practices of insulin prescription we do have? What kind of insulins and for what patients? Once more, there are some things, peculiarities that we are going to discuss today, but in case we are talking about the narrow insulin prescription, the protocols and recommendation guidelines, the more modern or less modern medication and different kind of models of treatment exist. That's the reason. And the patients, the involvement of patients into the treatment, the glycosylate hemoglobin, which is the new standard, the new practice that exists, the new way to cooperate. These analytics were done thanks to the register. And finally, right now, we may analyze and to influence by having all of this data right now. What's the next step? How it is going to be next? Because the project is still in a pilot stage. So what do you think? What kind of changes we are going to face in the nearest future, and what might be done in order to protect it? Any kind of enemies, so to say, in this situation. Everyone who is against it, they are afraid to go in public. They are afraid to get into the public discussion. When we discuss the data, when they are available, and when we discuss to talk about it, the issue itself, that we start to talk about the local budgets, about the governmental budgets openly, we start to name the numbers and to show them. That's how we shift and move to the new level when we start to discuss the treatment in some of the oblasts, in some of the regions, the issue of not insufficient funding. We faced, okay, we might just say about the history of implementation of the register for these 2.5 years, while we've been working how exactly and what kind of issues and challenges happened in each of the departments, but still, regarding the future, the picture gave us and looks for us that register should continue its work. To do that, we need to talk about it, we need to remember about it. We should not give the possibilities to take a step back to the previous procurement of the insulin. The publicity, the public discussion of the State Expert Center work and ministry regarding the support of the register, should work. We need clearly to understand the issue why patients are not satisfied, the issue of insufficient funding. They should be discussed in the public discussion. We need to understand in which cases and why patients do not receive sufficient treatment, adequate treatment. What kind of issues do we have with the pharmacy network? What kind of issues do we have with the physician prescription, or maybe this insufficient funding issue? And to find out some kind of solutions and to highlight them, we need to discuss it. That's our register, and we need to protect it. The key issues that was raised regarding the issues, that's not insufficient funding. So when we observe the insufficient funding in the regions, what's the reason for that? That the Ministry of Healthcare does not make correct calculations, or there are maybe any kind of other issues about that? The ministries, as I mentioned before, has never decreased the subvention. The amount of finances each year is the same, but the amount, in case we're talking about the number, was always increasing. Regarding the local budget involvement, the involvement of local authorities, the understanding that the local authorities are always present, and the regional state administration needs to be involved in this funding. That's what we lack. And of course, it was much easier to say that, yes, Ministry of Healthcare doesn't give enough funding. No, Ministry of Healthcare gives the whole funding needed. We are always talking about the need, that there is a need to shift to 100% central financing and funding, and to get away from this local budget subvention. And for the reimbursement, according to the register, all of the insulins needed. I don't really think that we are going to get into the depths of the tools, how to do it from the financial point of view, and how we may play, or how we may work with the local budget costs, or how do we move to the central budget. We're not going to discuss it. In fact, patients should not be interested into this. Patients should get to the pharmacy, receive insulin, and insulin should be reimbursed, and pharmacy should receive the funding for the insulin. So the patient organization should not think about it at all. At the level of the ministry and department cooperation, we need to find out the optimal mechanism that is going to work and to regulate in the future. At this moment, today, that's two budgets I'm going to underline. That's the ministry budget and local budget. And we have some complications, some issues with the local budget. And right now, I would like to sum up a little bit our discussion. Please, Shehnaz, giving you a floor, the president of the International Diabetes Federation. Federation, yes. So what do you hear right now, these issues that we were discussing? Whether this is the issue which is typical for the whole European region, and what's your opinion? What should Ukrainian government do in order to improve the situation with the provision of the insulin regarding the experience of other European countries?
Thank you so much. First of all, I want to thank the International Diabetes Association of Ukraine for inviting me and giving me the opportunity to be part of this discussion. So I want to thank to Lyudmyla, Petrenko, and all the team. I think in Ukraine, let's start from Europe. Europe, when we say International Diabetes Federation Europe, we are speaking about 46 countries. So we are a wonderful mosaic with countries with well-established healthcare services and systems, and the countries who have less resources or less developed healthcare systems. So it's a wonderful mosaic in Europe, and each country learns from each other. I mean, we learn from each other in Europe because there are things that the low-resource countries accomplish despite the low resources, and then there are high-resource countries, I mean, with high resources, but I'm sure they could make better. So therefore, it's a wonderful mosaic. Regarding Ukraine, I think regarding the start of the e-register and the reimbursement, Ukraine has done a huge step forward. We have still in Europe some countries in which the reimbursement system doesn't exist. E-register is on the other side, something else. This is a very hot topic also for IDFU. Europe, this is one of our priorities for the term, because in Europe we don't have a standard register. And because when we say register, if you want to collect data, if you want to compare, if you want to see where you were and where you are heading, you need to have the data. Plus, from a regional perspective, we should be saying something for Europe as well, so compare the data and see. Unfortunately, this is not the case in Europe. For the e-register, from what I heard from these discussions and also from what I know before, you have a register mainly through the endocrinologists and mainly for insulin-using patients. So I hope that, I mean, as I said, this is a huge step forward, but of course we should have this for all types of people with diabetes. Because what we think is that there are, I mean, 10% of the people with diabetes has type 1 diabetes. The other 90% have type 2 diabetes, and many of them do not use insulins. But on the other side, when we speak about the burden of diabetes in the countries, both for the person with diabetes, for their families, for national economies, we are speaking with this huge group of type 2s as well. So therefore, this need to cover also the people with type 2 diabetes, whether they use insulin or not. But as I said, nothing happens in one day, so it's a huge start. The important thing is to start something, and it's wonderful that in Ukraine you have started the reimbursement system. As to the insulins, I think it's a wonderful thing that you cover the insulin for people with type 1 diabetes and under the age of 18 years. But I think, again, there is a huge issue with the people who are over the year of 18 years and who have type 2 diabetes as well. So you have some criteria there. I was just speaking with Professor Iryna in the morning about this. You have a criteria, a low criteria for HbA1c, 7.5, which is not easy to reach, and especially when you don't have a reimbursement system for blood glucose meters and strips, because to reach a goal, you need to measure. I mean, some people, especially when it comes over the age of 18 years, I'm not speaking for the patients with type 1 diabetes and less than 18 years. It looks like wonderful for them, but for the others, I mean, some of the people have to measure several times a day their blood glucose to control their blood glucose. At the end, they are living with it throughout the day. There is stress, they are at work, and so, I mean, so many things. And then the huge number of the people with type 2 diabetes, which at least have to measure their blood glucose several times a week. So if you don't measure, how can we expect people to reach this goal of 7.5%? So in this case, I mean, only a small percent of people over the age of 18 years gets full reimbursement for their insulin only, not for the other medications plus, I mean. And then the other thing is, even if they would have the strips and blood glucose meters reimbursed, still there are studies in several countries in Europe and also beyond, not only in Europe, that, I mean, only a certain percentage of people with diabetes reach this 7.5. For example, I will go back to my country, to Turkey. We have good reimbursement system right now there. But still, the HbA1c, the mean HbA1c, although we don't have a nationwide survey from the smaller surveys, it's, I mean, regarding to some people, it's 8.9, and regarding some others, 9.2, which are high, but improving. After the reimbursement system, it's improving. It was somewhere in something like 10 or something like this. And even if you go to Germany or other countries, still, I don't think that, I don't want to be wrong, but as far as I know, there is no country who achieved a mean HbA1c like 7.5. Okay, we have to give good, I mean, low criteria so that the people get motivated. But on the other side, we have to be more realistic. I mean, because what the studies show, unfortunately, many of them are not implemented into real life due to several things. So therefore, I mean, I think that this criteria should be reevaluated. I mean, so otherwise, again, congratulations for the huge step forward, both for e-register and the insulin reimbursement.
So, in other words, I'm not an expert, but in other words, it means that this register, it's just first step, which allows us to solve much more problems that are hidden this moment.
Exactly. It's a huge step forward. I mean, not only a step, but a huge step forward. Thank you.
Іншими словами, цей реєстр – це не тільки вирішення однієї з проблем, це перший крок для того, щоб вирішувати цілу низку проблем інших пацієнтів, про які ми навіть сьогодні згадували. Пане Олександр.
Я радію, тобто я відверто посміхаюся, що ця дискусія зараз взагалі...
I'm really smiling that this discussion exists right now. We may talk about the glycerized hemoglobin level. We may compare ourselves with other countries. We may say that the Ministry of Healthcare might indicate the departments their disadvantages. The departments may show the objective characteristics and to talk about their need. This discussion right now is possible because of the register. In the final discussion, the patient is going to receive its advantages. The experts might discuss the complications, about the treatment, about the protocols, about recommendations of treatment, about the efficiency of one or another policies. The finances and government workers might talk about the financing system and to cooperate between each other. And it's not just the ministry too to control the department to control, but just to show among the departments the real need. That's the huge instrument for the patients to influence the authorities of the local authorities. So right now we have an objective numbers, objective rates. We are just one family and we have patients with diabetes and they need our attention. And right now city-state administrations, local state administrations should be involved in one or another way. That's why we received a great tool and we need to have it, we need to improve it, and I'm really happy that this discussion is really possible thanks to the register. Thanks one more to the State Experts Center. Some of the tender commissions, those who participated in tenders, they were sad about it. We were not able to involve and to invite them to this roundtable. We still have some time going on. I would like to give the word to have some questions and to give comments for those who are here present. Please. We are going to have the mic here. Please present yourself, comment or question, and then I'm going to give the word to our participants. Yes, please, over there in the first row. We are going to be the next one. So the mic, please. You're going to be the next one, yes. Natalia Vlasenko, head of the Diabetic Foundation in Ukraine. Natalia Vlasenko.
The
Vice President of the Ukrainian Diabetes Federation and the active member of the Reimbursement Working Group. I would like to ask to the Vice Minister, to Olexander. I didn't hear any kind of concrete answers regarding the pilot of approval of Cabinet of Ministers. As far as we know, this order of the ministers, Cabinet of Ministers 239, that's the pilot project. Whether the Ministry of Healthcare to initiate before the Cabinet of Ministers to have the new order and all the documentation and legislation to have the new order of the Cabinet of Ministers where the reimbursement is going to be mentioned not just like a pilot project, but as the new way to ensure the patients with insulin, not only for those with the first type of diabetes, but also for those who have the type 2 diabetes, insulin-dependent patients. Whether it is going to be changed. Yes, let's hear the answer first of all. Before the implementation of register, during the implementation, we were in the situation when we acted blindly because we didn't have any kind of results, we didn't have this data, we didn't have these numbers. We had the needed amount which gave us from the regions and the tender procedures that existed. Right now, thanks to the register, we started to receive those information, started to receive the information regarding the amount of patients, whether they need insulin. Yes, of course, we may move. I really hope that the issue of reimbursement is going to be solved once and for all, and even further. When we're talking about the plans of Ministry of Healthcare, this mechanism should be implemented for other patients, for other diseases. So that's a great system. This is the small model how the provision of the patients with the medication should work. Right now, thanks for the register work, we have this data, we may have the right decisions taken. The first one, the most important one, that you face with these issues of insufficient funding, and in different kind of regions they have different issues. We reviewed these issues, we evaluated them, with intuition but objectively, and we may find out a decision in order to take them away, in order to destroy those disadvantages. We have some options whether to move to completely centralized funding or just to use the cooperation of funding of central and local budgets. All of the decisions are possible to be taken thanks to the adequate analytics. Yes, this kind of reimbursement should be done. But in order to make this new order, we do not need to forget about the first and the most important thing. We need to get the developers, the State Expert Center, out of the target and the Ministry of Healthcare. Right now, there is a fight going on for the register, to exist. And we have a lot of enemies and dangers. We are not talking about them right now because of the developers and State Expert Center that stop this danger wave on its own level, personally and on the level of the organization. So first of all, to continue to work with the register and to analyze the work for the last years, to take the right decisions or to take the optimal decisions regarding the financing in order for us to think further, in order to establish the right glycerized hemoglobin level and not to talk about the funding issue. So what's your opinion? Whether you, a current cabinet of ministers, are going to do it, or after the elections, according to the constitution of Ukraine, is going to be the new cabinet of ministers. What's your opinion? Who are going to do it? The cabinet of ministers doesn't stop its work after the elections. The Ministry of Healthcare has been working as it was working before, and it doesn't change each next day for our team. We work every day in the same way as we've been working, and we are going to continue this work. To protect the registers, that's not an issue just of our team. We have the advantages. As from the physician point of view, it's okay to work with, and one of more beneficiary, that's patient. You and me, the physicians, the physician community and patient community should really understand that this is our register, that's our toy, and no one is going to take this toy away from us in case something is going to happen. That's our main aim further. And it doesn't matter who are going to work in the cabinet of ministers or in the Ministry of Healthcare. That's our register. It doesn't act for the cabinet of ministers or Ministry of Healthcare. It acts for the patient. In other words, that's my personal idea. That's my personal opinion. When we have elections and after elections, the politics are really paying a lot of attention to the community, and that's why to protect the registers, that's also our story. Also by bringing it into the public. Please, you had a question. Dnipropetrovsk region, Kalashnikova Lyudmyla, the head of the Diabetic Association. First of all, the first question is going to be regarding the provision, whether the amount of subvention, because I'm going to give you numbers. The amount of patients in 2018 in Dnipro region that are insulin dependent, 4,207. In 2019, we have 5,500 patients. The subvention last year were 65 millions. Right now we have 72 millions. We do not have enough money. And 78% of this subvention were already used for this half of the year, and also the 20 million which were out of the local budgets. As far as I understood the question is, the amount of the budget subvention? Yes, about the budget subvention. So the question is that from your point of view, the budget subvention should be bigger because we have amount of the patients that raise. The second was regarding the list that was mentioned regarding the glycerized level of hemoglobin. HbA1c in the first quarter of 2013, patient has 8 units. In the second quarter, he has 7. He addressed the patient, he addressed the endocrinologist in order for him to be prescribed into another category in order to receive the reimbursement. He receives analogs. The endocrinologist said no, up to the end of the year, the patient should approve its analysis. It's still 9 months to go, and just starting from the new year, the endocrinologist will have the possibility to get him into the register for the reimbursement for free without additional payments. How can we solve it? How can we do not wait for 9 months? Yes, who is going to answer? As far as I understood, that's the primary, newly established patients. It is mentioned in the Cabinet of Ministers Order 239. After the first half year, patients should be on the co-payment independently from the level of HbA1c. In case it was 8 and it became 7, he receives insulin for free. Right now, you need to talk about it in each critical case. And I would like to say regarding the local additional payment and funding, we have regions in Ukraine that have regional programs regarding the diabetes, and they give not just an additional payments and funding for insulin. We have the responsibilities among the local budgets. They procure the stripes for the patients for all of type of the private adults in some regions, and we do not have issues. The register right now has the possibility to control glucometer procurement. We are really optimistic, and we are really seeing that test stripes and glucometers are not going to be sponsored not only for children and pregnant, but also for adults. And in the register, it has the possibility to control it, how many stripes are needed, what kind of glucometer do they have individually for each of the patient. And I would like for you, dear journalists, to pay attention what was mentioned by Olexander, that we have to protect our register because we have a lot of enemies and dangers. I'm an official person. That's why I might say that we have developers that lost for the first 3 months of the register 56% of prescriptions and 9 areas. Why did they lose this money? Because they do not have patients, because they had so-called dead souls. That's why the main aim right now is to protect our register, and then we are going to do everything else. We want everything, and at the same point, let's do it from the start, but let's evaluate the things really in the real life. We are going to ensure with the test stripes and the glucometers, and that's our dream. I think it's going to get in reality, but our main aim is to protect the register from any kind of interruptions, because developers are under huge pressure. Please, that's what we are waiting for. Please, there was a question. This is going to be the last question. I'm the second guy who is present in this room. I'm really happy. There is Alexander, of course, and I'm the second one who gives a speech. That's why I'm the second man. My name is Roman Ostrovsky. I'm the head of NGO of parents and youth that have the diabetes. I would like to say just a few words. I would like to thank the organizers for this great conference, to thank Lyudmyla Petrenko for her 27-year experience in this huge work, and they achieved the point that we have e-registers and e-prescriptions right now. And I would like to say thanks to women that I see for the first time, but I feel like that's our person. I'm not diabetes myself, but I have a granddaughter who is 7 years old, and as a journalist, I'm completely dedicated to it. I would like to fight for this idea. And I have 3 questions. And I would like to thank Olexander, who in 2015, he told me how the reorganization is going to happen. He told us, journalists, how it is going to happen. And I asked Ulyana, whether do you believe in that reform? And she said, whether we are going to be preserved, we believe in. We were preserved. Okay, 3 questions, please. 3 questions. So the questions. Ternopil Oblast, Ternopil region, didn't receive, just received 27% of costs that they should have received. How do we need to understand it? Right now we are without insulin. The first question. So Ternopil Oblast is right now without insulin. Children start to feel it. Stripes. We received just 22% of the stripes. This year, we didn't have any kind of funding for the test stripes, so we do not have any kind of test stripes. And the third thing, and the Minister of Healthcare, a few years ago, you showed the medication, the machines in the laboratories to evaluate the HbA1c hemoglobin level, but they are not used because no one uses them. I'm talking about our region, about Ternopil. I may just tell you, yes, we understood your questions. That's why I would like to know, and I would like to ask, please, next year, to give our 100% funding for insulin, and then we're not going to have this corruption, we're not going to have this insufficient funding. Yes, okay, let's have the answer. I'm going to ask these questions. In order, in the nearest future, to receive the 100% funding, what do we need to pay attention to? The budget, the government budget, the local budget, or the level of provision and performance of these local budgets and governmental budgets? Oh, you know how to set the questions. We need to talk about the formation of the government budget and local budgets too. In case we talk about our view regarding this issue, the most important and the most complicated thing for us is to involve the communities and the orientation of communities, to underline the role of the local authorities in the realization of medical reform and its implementation. That's the field for our to grow, because in fact we do not have this understanding, we do not have the feedback, and up to this moment the central authorities, we are reporting, we are contacting actively, but we do not have this feedback, we do not have enough press conferences on the local level. They are not happening, but we would like to have them, and we have a lot of issues by organizing this kind of meetings in each of the oblasts, in each of the regions. I would not to change some things with some sword, what should be done with the small knife on the local level. The local authorities should work according to the local needs. I would ask and to have these meetings and discussions on the local level. Do not to wait to solve these issues from the central level. That's why I would like to make an accent from the local level government. Yes, over there. Sorry, the mic. Sorry. There is a subvention from the local budgets, 17 millions of 240,000. That was the subvention. Have you already used it? Oh, you just used the 4 millions and 200,000. So the local budget have already spent just 28% out of the subvention out of the government. Have you understood it? So on the local level, thanks. You need to ask them why do not they spend the money that was given by the state. That's a great advice from our media center, crisis media center, the best way is to organize it on the local level, because the blind game is the favorite game on the local level. They say, okay, that's there in the ministry, not us. Thanks for this really interesting discussion. We are going to finish an official part with the questions, answers, and discussions. I've heard a lot of new. I'm not a huge specialist in this topic, but I would like to give a word to this more kind of an interesting speech to Lyudmyla and to Shehnaz. They have something what to say, which is much more urgent. Please, Mike, please. I would like to ask Alexander Pavlenko, who was the previous vice president, and Kvatashvili, who was the previous minister of healthcare, and Prime Minister Yatsenyuk, for their political discussion and approval of the reimbursement implementation. I would like to say thanks to the Ministry of Healthcare and to give them this kind of diploma for raising the possibility of effective provision of medications for diabetes thanks to the reimbursement issue. So our relationship was different with this Ministry of Healthcare. You hear a lot of things from them, but I think that these awards that we are going to give you today, and it is going to be present in the Ministry of Healthcare, we fully understand that there are going to be some changes. As in government, there's going to be the new Prime Minister, and in case the new Prime Minister is going to happen, we are going to change the Ministry of Healthcare stuff, but this diploma is going to be present there in the ministry. And those people who are going to come, the newly established, they're going to understand that we are not going to give them the possibility to do it that way for the register, for the e-register to stop it, but they need to continue the work of the reimbursement system, and we are not going to get back to the tender procedures, please. This is kind of diploma. That's for the Ministry of Healthcare. And I think that the new established members, or those who are going to be left, who are going to fight with us further in order for our patients to be provided and provisioned with the insulin, we need to calculate the costs, the budget costs, and the most important, we need to have an individual approach to the patient and the prescription of one or other types of insulin. And that's what we were wanting to achieve. And today we have it. That's why we need to fight for the final point in order to preserve and save this system, to save the e-register and all the other diseases, to have an example and to have the e-registers to be created for other diseases. And then the governmental costs budget is going to be calculated, and then we are going to have enough funding for the healthcare system in general, in case we're going to have the register for all the diseases. Thanks you.
If Europe, we also want to thank to the Ministry of Health and also to the expert committee, because we strongly believe that this is a huge step forward. And thank you so much for this.
Just a few words.
I would address our colleagues. In fact, the ministry and the State Expert Center, we just give you the tool. I please ask you to remember, the patients to remember, that we need to remember about the routine work of the medical nurses, of endocrinologists on the primary line of the healthcare. And would like to say thanks to everyone, to individually, to all the physicians, because we fully understand that people treat people and not an Excel table. That's why I would like, first of all, to say thanks to all of our colleagues, because without their work, without their nurse and physician work, we cannot achieve the result. And we are just talking about one of the tools that are going to help you. Thanks you. Thanks. And at this point, we end up. Thanks a lot for this time. Thanks for this interesting discussion. Thanks. Bye.